Hello, my dear ones. Today I'm going to talk about nursing strike or why a baby may refuse breast milk. This is not a newborn baby. When your newborn baby refuses to breastfeed, usually there's a problem and you should get help for it. But we are talking about older babies, 5 months, 6 months, 8 months, older babies who've been breastfeeding very successfully, and all of a sudden they refuse to breastfeed. And usually you will see that the babies themselves are unhappy about this. They refuse to breastfeed, but they are not happy. That is what we are talking about. And this is called a nursing strike. The babies are on strike, basically. That is what it means. So let's look at some of the causes of nursing strike, or why your baby who's been breastfeeding successfully all of a sudden refuses to breastfeed. So the first thing to think about is pain. Sometimes these babies have pain in their mouth, maybe because they are teething, or because they have some sauce in their mouth, or they have oral thrush. So they may find it difficult to breastfeed because they have pain in their mouth, and that is why they refuse to breastfeed. Sometimes it may be because they have ear infections, and once they suck, there's some pain that they feel from the ear because of the pressure. The mouth and the ear are connected. So this may be because of an ear infection, and then they refuse to breastfeed. And you will be able to see that my baby is not happy. My baby is refusing to breastfeed, but my baby is also not happy. It may also be because they have a cold and their nose is stuffy. So it's very difficult for them to breathe and to suck at the same time. And so they don't want to breastfeed. So that's another reason why your baby may go on a nursing strike. Another reason may be because the milk is not coming fast enough. So then out of tiredness, like what kind of hard work is this? They just refuse to breastfeed anymore. It may be because there's a change in your schedule or a change in your baby's schedule. I remember this story from when I used to work with one particular boss. She shared what happened with her baby. She would leave her baby with her mom and go to work, and then at intervals she would go and breastfeed and return to work. And she said one day it was so busy at work she could not go to breastfeed at the time she would usually do so, and it took maybe an hour later for her to get there. And when she went, her baby just refused to breastfeed. So sometimes when there are these changes in your schedule or change in your baby's schedule, they may refuse to breastfeed as well. So that's something that you can look at. Sometimes there are moms who are breastfeeding and the baby bites their nipple, and their reaction startles their baby so much that the baby doesn't want to cause the mom pain, and the baby will refuse to breastfeed. So it's just the fear. The baby fears the reaction that you exhibited when the baby bit your nipple, and then they don't want to cause you pain, and then they refuse to breastfeed. Sometimes it may be because you begin to smell different. Perhaps you have changed your soap or your deodorant or your perfume, and you smell so different to your baby that they are not sure, so they don't want to breastfeed. And sometimes it may be because the taste of the milk has changed, so they don't want to breastfeed. The taste of the milk changes with things like maybe you've started taking some drugs, or even sometimes just your period can change the taste of your breast milk, and that makes it difficult for the baby to breastfeed. So these are some of the reasons why your baby may go on a nursing strike. Usually a nursing strike doesn't last long, about 2 to 5 days, but there are people whose babies have refused to breastfeed for even 2 weeks, and they were able to return to breastfeeding successfully. And let me just say here that some people say that if you haven't breastfed your baby for a few days, the milk in the breast is spoiled. It's not true. The milk in the breast never gets spoiled. So you can resume breastfeeding successfully even if your baby has been on a nursing strike. So what can you do at the time that your baby is on a strike? You should keep expressing the breast milk to keep it flowing, because this situation usually is temporary and your baby will be able to breastfeed. So just keep expressing the milk so that your milk supply does not go down. So keep expressing the milk. And then when you express the milk, you can actually try feeding it to the baby. So you can use a syringe, you can use a cup, you can use a spoon, you can use a bottle to offer it to the baby. Sometimes they may take it, even though they are refusing to breastfeed directly from the breast, they may take it when you do it that way. And if you are worried that your baby may be sick, if you are worried that your baby may be in pain, see a doctor, because these things can easily be sorted out, and then you can continue your breastfeeding journey. Try nursing your baby when they are sleepy, because when they are sleepy, they offer less resistance. All of us, when we are a bit sleepy, we don't think too hard, we don't think too clearly. So try breastfeeding your baby when they are sleepy. The other thing you can do is to breastfeed your baby while you are moving. So you can carry the baby and breastfeed while you are moving. Sometimes it calms them down. They begin to even feel sleepy, and then they may take the breast. Try changing the position where you are breastfeeding as well. It's actually good for you to breastfeed from different positions, because it helps the baby to remove milk from the different parts of the breast. So try breastfeeding from a different position. Your baby may be able to take it, especially if it's because they are in pain when you hold them in a particular way. Just try breastfeeding from a different position. And then some babies who have become very social, like 6-month-old, 7-month-old babies, you see that even from 4 months, sometimes you see that they are breastfeeding and they are distracted. They are turned outwards. So also try feeding your baby in a place where there isn't much distractions. So perhaps you can turn the TV off, you can turn down the bright lights, make the room dim and quiet, and breastfeed your baby. Sometimes without a distraction, they may be able to take the breast milk the way that you would want them to take. Another thing you can do during this nursing strike is to just have physical contact with your baby. Keep them skin to skin, even though they have refused to breastfeed. Just hold them, give them a lot of attention, because sometimes you find that just holding them, giving them a lot of attention makes them come back to the breast. But like I said, sometimes it's because your smell has changed, your perfume has changed, and then they may be confused a bit. So if you think that you just started using a new soap or a new pomade or a new deodorant and your baby is not breastfeeding, one of the things you can do is to change this and see whether there's any change for you. Most babies who go on a nursing strike are actually not ready to wean themselves from the breast. So this is temporary. So don't just give up immediately. If you really want to continue breastfeeding, most likely you will be able to. So these are some of the things that you can try. Let's try them. Let's see whether it helps you. Or if you've tried this before, we want to learn. You can put it in the comment section. What has happened when your baby went on a nursing strike? Was that the end of the breastfeeding journey for you? Because for some people, it will be the end of the breastfeeding journey for you. So let's see. Let's hear from you. Put it in the comment section. Thank you so much for watching this video. And if you have not yet subscribed, please subscribe.